Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about body temperature, as we have discussed about how we can assess it, then also the procedures of which we will be performing while we are assessing the body temperature. In today's session, I'm going to teach you about the alterations in the body temperature. So as I've told you that the body temperature is defined as the balance between the heat which is produced inside the body as well as the heat which is lost from the body. So here, if there is changes in the body temperature outside the usual range, that is, if the body temperature of an individual is higher or lower than the normal value, then it will affect the hypothalamic set point. When does these changes in the body temperature occur? These changes in the body temperature can occur because of excessive heat production or excessive heat loss, or even because of the minimal heat production or the minimal heat loss which occurs in the body of an individual. If there is any alteration in the body temperature of an individual, as I've told you, it can lead to several diseases. So in today's session, we will be discussing about three conditions. That is the hypothermia, the heat stroke, as well as the hypothermia. What is hypothermia? In simple words, I can say that hypothermia is an elevated body temperature above the normal value. And why does this temperature rise above the normal value? It rises because of failed thermoregulation. So as I've told you in the previous session, that thermoregulation is the process of maintaining a balance between the heat which is produced in the body as well as the heat which is lost from the body. Here, if there is a failed thermoregulation, then it can lead to an increased body temperature, and this increased body temperature or elevated body temperature is known as hypothermia. This hypothermia usually occurs when the body of an individual produces more heat or it absorbs more heat than it can dissipate. So here, when there is no balance between the heat produced and the heat lost, when there is excessive heat production in the body, then this will ultimately lead to an increased body temperature. So here, when the elevated body temperature is sufficiently high, then hypothermia is a medical emergency which will be requiring an immediate treatment, because if an immediate treatment is not given, then it can even lead to disability or death of an individual. So now let's move on to the definition of hypothermia. So hypothermia is defined as a serious medical condition in which the body temperature of an individual reaches higher than the normal level. This hypothermia is a medical condition which is usually caused in a person who is prolonged exposed to heat, or even to an individual who is constantly performing an excessive physical activity. So here, since the normal body temperature of an individual is 98.6 degree Fahrenheit or 37 degrees Celsius, here when the body temperature of an individual is above 104 degree Fahrenheit or 40 degrees Celsius, then this condition can also be considered as a life-threatening one. So I hope you guys have understood what hypothermia means. Next, moving on to the causes of hypothermia. So the first cause, as I've said in the definition, it is usually caused because of prolonged exposure to heat or because of excessive physical activity. Here, if the person is exposed to the heat for so long, or if he or she is standing near a heating element for a long period of time, as well as not being hydrated or being to seek for a shade or even for a cooler temperature, then it can lead to a condition known as hypothermia. So when the body of an individual reaches 104 degree Fahrenheit or 40 degrees Celsius, the individual might just be feeling ill. However, if the temperature rises to 106 degree Fahrenheit, then the brain will start getting adversely affected by this temperature, and if it is allowed to reach 113 degree Fahrenheit, then a death of that particular individual can also occur. So it is very important that we should never expose our body to a condition where it cannot cool itself. Why? Because it can put anyone at risk. Either you're healthy or either you are not feeling well. You should make sure that you should never expose your body to a condition whereby it will not be able to cool itself down. So since we've discussed about the causes, now let's move on to the next, that is the risk factor. So, in order for an individual to be at risk of developing this medical condition, it is not necessary that the body temperature of an individual must hit 100 or 104 degrees Fahrenheit. However, one's own general health or the lifestyle which they are following in their day-to-day life can both increase a person's chance of suffering a heat-related illness. Some of the health factors which may increase the risk of an individual to suffer from this condition include exposure of the body to heat, poor circulation, infection, inflammatory process, increased metabolic rate, inefficient sweat gland, and changes in skin which can occur because of the normal aging process, as well as other factors including being substantially overweight or even underweight, or if that particular individual is having the habit of drinking alcoholic beverages. So these are the few risk factors that can lead an individual to suffer from this medical condition. Since we've discussed about the cause, about the risk factors, now we will be discussing about the clinical manifestation which you will be observing in a person who will be having an elevated body temperature. So initially, which means at the starting phase, when the client will start developing this elevated body temperature, then these are the few of the signs and symptoms that you may encounter in them. The first one is the increased heart rate. The second is the increased respiratory rate. They may complain that they are feeling cold. They may also shiver, as well as when you touch them, they may have a cold skin. There may also be the presence of goose flesh on the skin, as well as cessation of sweating. These are the few of the signs and symptoms that you may encounter in the initial period. However, during the course of fever, you may encounter that the client will be having absence of chills, warm feeling of the skin, photosensitivity, glassy eye appearance, increased pulse as well as respiratory rate, mild to severe dehydration, as well as drowsiness and restlessness. So these are few of the signs and symptoms that you will encounter during the course of fever. However, as the fever starts subsiding from the body of an individual, then the particular individual will be experiencing the signs and symptoms of sweating, the skin will appear flushed, there will also be increased shivering, there will be dehydration, which would ultimately lead to increased thirst, there will be loss of appetite, there will be muscle aching, the person will be feeling weak, as well as there will be warmth feeling of skin. Here, these are the few of the clinical manifestation which you will be encountering on that individual during the initial stage, during the course of fever, as well as when the fever starts to subside. Now, moving on to the types of fever. So whenever an individual is having an increase or an elevated body temperature, you cannot just say that he or she is having fever. So now I will be teaching you about the different types of fever, so that a correct diagnosis can be established, and not only according to the degree of the temperature elevation, but also by its circadian variation, which means by the type of fever that an individual is having. And following here are the major types of fever that we will be seeing in an individual. So the first type of fever is the continuous fever. So if a client is having a continuous fever, then what happens is that the body temperature of that client remains above the normal level throughout the day, and even if there is presence of fluctuation of this body temperature, then it will not fluctuate more than 1 degree Celsius. And this is for a period of 24 hours, which means for a period of 1 day. And this elevation of body temperature will not reach to the normal values for days or even for weeks. If a client is having this continuous fever, then it may be a characteristic features of lobar pneumonia, of typhoid fever, urinary tract infection, and brucellosis. So what do you mean by continuous fever? So here, continuous fever is a fever in which the body temperature of an individual will be above the normal level, and this will continue throughout the day, and even if there is fluctuation, there will not be more than 1 degree Celsius fluctuation in the body temperature. And also, if a client is having this continuous fever, then it can continue for days and sometimes even for weeks. So if a client is having this continuous fever, then it also may be a characteristics of lobar pneumonia, of urinary tract infection, of brucellosis, as well as of the typhoid fever. Now moving on to the second one, that is remittent fever. So this remittent fever is also similar to the continuous fever. So what happens in this remittent fever is that the temperature will rise above the normal level throughout the day, and even if there is fluctuation in this body temperature, it will not be more than 2 degrees Celsius, and it will never reach the normal point. Here, as we've seen that in continuous fever, fluctuation, even if it occurs not more than 1 degree Celsius, right? But in this remittent fever, it will occur but not more than 2 degrees Celsius. And if the client is having this remittent fever, then it can be a characteristics of tuberculosis, of bronchopneumonia, purulent infection, typhoid, infective endocarditis, and you will also find that this type of fever is common in practice. Remittent fever is also similar to continuous fever. However, in remittent fever, there will not be a fluctuation which will be more than 2 degrees Celsius, and it is also a characteristic of tuberculosis, bronchopneumonia, purulent infection, typhoid, as well as infective endocarditis. And then moving on to the third one, that is intermittent fever. So here, if a client is having intermittent fever, then you can see that there will be a sudden rise in the temperature, even up to 39 or 40 degrees Celsius. And then within a few hours, it will subsequently fall to the normal level, that is to the 37 degrees Celsius. So what happens in this intermittent fever is that there will be a rise in the normal body temperature. It may also reach the 39 or to the 40 degrees Celsius. However, it will again fall to the normal level. And also, if the client is having this intermittent fever, then you can also see that the body temperature may rise again in 1 to 3 days. This type of fever is also a characteristics of malaria, of Kala-Azar, as well as septicemia. Then moving on to the fourth one, that is the hectic or the septic fever. So what happens in this hectic or septic fever is that if the client is having this type of fever, there will be a sudden rise in the body temperature, even up to 39 degrees Celsius, and also there will be a sudden fall in the body temperature during the same day. And sometimes this body temperature does not only fall to the normal level, but it can also go lower than the normal body temperature. If the client is having this type of fever, then it is a characteristic of sepsis or even of severe form of tuberculosis. And then the fifth one here is the crisis fever. So here, if the client is suffering or is having this crisis fever, then you will see that the client will first be having an abnormal high temperature, which is above the normal value. And within a few hours or days, this temperature of theirs will fall back to the normal value. When the client is having this crisis fever, the value does not only reaches to the normal value within a few hours or within a few days, but you will also see that there will also be an improvement in the client's condition, and this is known as a true crisis. If there is an improvement in the client's condition, it is known as a true crisis. However, if this temperature reaches back to the normal value and there is an improvement in the general condition, then it is known as a false crisis. And then the sixth one is the inverted fever. So what do you mean by inverted fever? This is a type of fever in which the highest range of the temperature is recorded in the morning, whereas the lowest range of the temperature is recorded in the evening. Here, if a client is having this inverted fever, then you will be seeing that they will be having a high body temperature in the morning and a low body temperature in the evening. And this type of fever is also a characteristic feature of brucellosis, sepsis, as well as tuberculosis. And then the seventh one is the irregular fever. So here from the name itself, you can understand that there will be an increased body temperature. However, there may be presence of variation as well as indefinite in the body temperature. And this usually occurs if that particular client is suffering from influenza, from dysentery, from rheumatism, as well as from tuberculosis. And then the eighth one is the fastigium or the stadium fever. So this is a type of fever. There will be a period when the body temperature has reached its maximum and remains fairly constant at a high level. So as we've seen that in the previous fevers, like whatever we've discussed till now, what happens is that the body temperature will rise and again will reach to the normal depending on the days. But here in fastigium or stadium fever, what happens is that there will be a period when the body temperature has reached its maximum and remains fairly constant in a higher level. And the next one is the lysis fever. So if a client is having this lysis fever, then you will find out that there will be a temperature fall in a zigzag manner for 2 to 3 days, or sometimes even for a week, before this body temperature reaches the normal value. And this will also be the time where you will be finding that the other symptoms will also gradually disappear. So what happens in this lysis fever is that the body temperature, which is higher than the normal level, right, will be falling to the normal level in a zigzag manner, and it may take 2 to 3 days, or even it may take a week. And also during this time, you will also see that the symptoms of that particular client will also gradually disappear. And the next one here is the hyperpyrexia. So what is this hyperpyrexia? This hyperpyrexia is an extreme elevation of the body temperature during the course of fever. Okay, so when there is an extreme elevation of the body temperature during the course of fever, then this is known as hyperpyrexia. And during this, you may also find that the body temperature of an individual may even rise up to 41.5 degrees Celsius, or we can say 106.7 degree Fahrenheit. And then the next one is the low grade fever. So if the client is having a low grade fever, you will find that there will be an increase in the body temperature, yes, especially in the evening time for several days, but this body temperature will not exceed 37.8 degrees Celsius. From the name itself, right, low grade fever, so there will be an increase in the body temperature. However, it will not cross 37.8 degrees Celsius. And if a client is having this low grade fever, then this does not really indicate that he or she is suffering from any disease condition. However, it can sometimes also be related to tuberculosis. And the last one here is the Pell-Epstein type. What happens here is that there will be a regular alteration of recurrent bouts of fever and afebrile periods. What happens here is that the temperature may rise for 3 days, then stay on that value for 3 days, and then even subside on the next 3 days. So what happens here is that the body temperature of the client may rise for 3 days, it will remain high for the next 3 days, and then after that, the next 3 days it will subside. And then it will also be followed by a pyrexia for 9 days. What happens here is that the temperature of an individual may rise for 3 days, remain high for the next 3 days, and then start subsiding on the next 3 days. And this will also be followed by a pyrexia for 9 days. So these are the different types of fever. Now moving on to the terms which is related to fever. So the first one is the fever spike. So if a nursing professional or if any physician says that a client is having a fever spike, then you should understand that it means the temperature of an individual is increasing rapidly from the normal temperature. However, returning of the body temperature back to normal occurs very shortly, even sometimes it can occur within an hour. So when you encounter a client with this condition, then this is known as fever spike. The next one is the malignant hypothermia. This is nothing but a hereditary condition of uncontrolled heat production in the body of an individual, which usually occurs when the client receives an anesthetic drug. The next one is pyrexia of unknown origin, which means there will be presence of fever but with an unknown cause. And then pyrexia, which means elevated body temperature above the normal level. Then hypothermia, or also known as hyperpyrexia, which means temperature such as 41.5 degrees Celsius or 105.0 5.8 degree Fahrenheit is termed as hyperpyrexia or hypothermia. So if a client is having a body temperature which is 41 degrees Celsius or 105.8 degree Fahrenheit, then it is known as hypothermia or hyperpyrexia. Then febrile, which is usually denoted for a client who is suffering from pyrexia. Then a febrile, which is usually denoted for a client who's having a normal body temperature, which means a body temperature in the normal value or in the normal range. So these are few of the terms which is also related to fever. Then moving on to the next, that is the nurse's action. What are the various things you can do as a nurse when a client is suffering from hypothermia or from fever? We should assess the vital signs, we should assess the skin color, the skin texture, as well as their temperature. We should also see their lab reports for WBC as well as hematocrit. And if the client is having an increased body temperature, then we should provide ventilation for that particular room. Whereas if you see that the client is having symptoms such as shivering, or even if they are having a chilling sensation, then you can provide blanket to them. You should also provide a balanced diet as well as adequate fluid, because they may be suffering from dehydration. So that is why good balanced diet as well as adequate fluid must be provided. We should maintain the input-output chart as well as the oral hygiene in order to keep the mucous membrane moist, and we should also restrict the client from performing any physical activity. Why? Because it will enhance the heat production in the body. We can also provide sponge bath in order to enhance heat loss. And we must always provide dry as well as clean clothing and bed linen. We must provide the prescribed analgesic and antibiotics if it was ordered by the physician. And the last one is documentation. Now, the last one is the restorative strategies. So here are a few of the restorative strategies, that is managing the fever. How can you manage the fever? By maintaining rest, by maintaining comfort, by maintaining hydration, by maintaining the nutritional status, by consuming or by taking the antibiotic drugs, by taking the antimicrobial drugs through a rapid sponge bath, as well as by the use of fan. So these are the various things that you as a nurse can educate the client so that they will be able to help themselves recover from this medical condition. So now here we've come to the end of this topic. So in today's session, I have discussed with you about the alteration in the body temperature. We have discussed about hypothermia in detail. We've discussed about what hypothermia is, what are the causes, the risk factors, the clinical manifestation, the types of fever, the terms which is related to fever, as well as the nurse's action and the restorative strategy. So I'll be meeting you guys in another session whereby I will be teaching you about hypothermia as well as heat stroke. So until then, have a good day. Thank you.